All right, so we have our first patient and client, and what I'm looking for, the foot is always tell you what's going on with the person, and you can find out a lot of good stuff for Natalie. So look at this knee, is looking this way, and it's collapsing inside. This knee, yeah, it's kind of same thing, is going this way and it collapsing inside. So it's already a signal for me to get this knee outside and correct this knee. But look at the bone is right here. You see this is kind of like rounded up here. You see this? What's happened here, I think she put too much weight on this one. So when she step on the front more. And yeah, she's okay. She have nice arch. And this one is a little bit collapsing, but yeah, I will pay attention. Her foot is, you can see the fingers are always pointing this way. Sometimes you can see the hammer toe, the toes come in, that's probably gonna high arch. And sometimes people collapse in. Yeah, that's maybe when you walk, this is start collapsing. When she's standing, it's fine, but maybe when she walk, it's completely different. Definitely, yeah, we definitely need to work on that. I probably work on this tibialis muscle and yeah, correct this knee first. We have to check the hip and mobility. Okay, so what we're going to do, we're going to do a little test right now. So go ahead, lay down face up. All right, so what we're doing right now, we're going to check the hip. We're going to check the ankle mobility. This is the simple test. We're going to do external, internal rotation of the hip. She a little bit limited up here. She's pretty good on external rotation. And what I'm going to do, I'm check this ankle. I have to be 20 degrees, and I see it's limited. And this is limited too. So we have ankle mobility problem here, and let's check the another one. I'm gonna stay this way. I know it's gonna be uncomfortable for me. It's limited, and this one is limited too. Now we're gonna check ankle. It's limited here, and you feel that click? Mm-hmm. Yeah. So what happened when I start moving this way, that was a click in that tibia. So that's the tibia joints right in here. So that means something already tell me it's not worked properly. All right, but today we're gonna work on the plantar fascia, and we're just gonna show you this technique. So turn face. Natalie's down, and what we need to do, remember, we need to work on the whole kinetic line, superficial kinetic line. It starts on our heel, all the way down, and finish in your occipital area. Sometimes the touching of plantar fascia, this foot area is going to be really sensitive and really painful. Like I said, I use this Quanta muscle rub and Quanta spray, which is get this little freezing sensation. So I spray, I don't use any lotion, any oil. What I want to do right now, I want just kind of warm up this area. What I'm doing here, you can use your thumbs, like I said, and I'll always go toward the heel. I'm not going away from the heel. I don't want to stretch more. So what I'm doing here, just open this up, really easy. How's it feel? Good. Make sure it's no pain. Like I said, if you dig in there, it's going to be really painful. So let's start with open up. Also, you can use your forearm, and what you do, you just push this way. And if this is big guy or you need to do good deeper work, you can use this forearm, just rotate toward the heel, and it's probably going to be around 4 or 5 minutes. How's it feel? Does it feel good? Excellent. Do you feel that freezing? Yeah. Yes, I feel in my arm. It feels actually really good. So I highly recommend for massage therapists, use this kind of stuff, CBD balms, everything, because it's going to really good feel for your hands. And okay, that's the stuff. Now, after I warm up and work on this tissue, the plantar fascia, I want to use my 2 thumbs just like that and find that heel, like that calcanean bone, or the splint, right in there where his attachment is. Now I'm gonna pointing to this heel, and what I'm doing, I'm start doing movements. I move to the left, I move to the right. Make sure it's no pain in the knee, and I can feel when I'm going up here, it's like pushing me away. Okay, I push toward that heel, calcaneus. And I'm moving around. How's it feel? It's feel good. So what we're doing here, after we work on the foot, we work on that plantar fascia, we want to release the calf muscle. We want to release this calf because of fascia bags. What we're doing here, we can spray again with the Quanta, make that little freezing sensation. And what I'm doing here, I push really gently this foot down and kind of forky, like my hands look like a fork, and I just push, scoop down. Okay. Scoop down, feel that tension. It's right in there, a lot of tension. Next one, it's called, I call this chicken dance. You grab that foot, and what the move is right here, you just kind of flip it inside and kind of twist this way, really gently. So that's how it looks like. Just like that. It's like you can dance in a nightclub like that. And now you're gonna apply another hand to this tuning fork, and this movement is come this way. So you're gonna squeeze your elbow toward your body, toward your rib. And this is move is come this way, this come is this way. And this is how it looks like. I'm recording, hold on. So this is how we rotate it and create that, release that fascia bags. Okay, again, come back to scooping down. Now we want to work a little bit on mobility of our ankle. I come up with a tuning fork on both hands, just like that. Lock it in, lift this foot up, knee out, up, and I'm just rotate in and out, in and out. I use my body. Feel a little click up there. Now I push down toward the table and do the same thing. Same movements. Lift it again. There we go. And I do this several times. 3 times for sure. Now, fascia bags again. If person have a little bit sensitive, after we're done working on when person prone position, we turn it to supine position. I want to see how this ankle active, how this functioning. So I'm going to ask you to dorsiflex this foot and let it go. And can you go more a little bit? Yeah, you see how limited it is? It's just not going anywhere. So we have to be a little bit more. Let me try to passively and see if I can do. No, you see it's not going up there. So that's mean we have some restrictions on this ankle. Okay. So what I'm doing here right now, I'm just oh, that's a lot of problems. Yeah. Look at that. This muscle, oh, man. So what I'm doing here, I'm just to get my tuning fork. You can use one hand, so you can do both hands. Let me get in the specific line. Okay, so what we're doing here, we're gonna check this ankle and see if this is worked properly. We're gonna ask her dorsiflex this foot. Go ahead. And you see how limited she is, and she's struggling. You see she started lifting her foot up. So we definitely need to work on that. So what I'm doing here, you can use one arm as a tuning fork like this and just work in this area. This is really, I can feel a lot of stuff going on up here. Or you can use both hands, just kind of like gently. Don't push on the tibia bone because it's going to be painful. So I use my thumbs, just guide me. And go. But I prefer my one hand and then go all the way up here. Yep, Start up here, and now I'm gonna ask her to move with me. So go ahead, move your dorsiflex your foot with me, yes, and let it go. Move with me very slowly, slowly, slowly. So I guide her. Now I want to do a little bit fascia work. I come up here with one hand and my hand another in the top. So what I'm doing, I'm gently squeeze muscle and pull this way. Very gently, you're not going to see my movements at all. And I'm going to push that way. I'm going to ask her to breathe, and here we go. You just breathe. You're not going to see a lot of movements up here, but I'm feel that moving under my foot. Okay. So basically I'm doing this movements. My top hands go toward her body and my lower go away. I'm better this way. You see what I'm doing here? Just like that. And I have to be slowly, it's a fascia, and I'm going to feel it. Breathe. And move that ankle, move that foot, yes. And let it go. Yeah, just like that. Perfect. Let's see if we can get her further. Stay here, stay here, stay here. Let it go. There we go. Maybe we have a motor control problem, so we're going to apply band and ask her to, to maybe restore that movements, because you see, I can't even help her myself, so it's definitely a mobility problem here. It's not a motor control, but sometimes when you push and you can go reach this little bit angle, like 20-15 degrees, it's absolutely fine, so no problem with mobility. It's probably motor control problem. That's what the big difference. So you always have to check passively if you can help the clients to reach this angle. So I always do. There we go. Also, we're going to work on this tibialis muscles. What I'm doing here, I'm applying my knuckles. We already done this, or thumbs, just like that. Cover, hold the leg with my other arm, and just ask her dorsiflex this foot. Just kind of move that. And what do you feel? You feel that movements under my, yes. So what I'm doing, I push this down toward the table. Just like that. Here we go. And I go all the way up and down twice, and work at a more fascial release twice too, and see how she's going to do it. Now David is going to replace me and work on the other leg. What we're doing here, we're just going to explain how our client have to work with a plantar fasciitis. Most people start doing exercise. I highly recommend start with a self-massage and work on the soft tissue and muscles. So the first one, you can just lay down, and I put this, lay down, and I get right in here, and I want you to, both? No, just one. Yeah, you can roll one and just roll it. I will, you go ahead, sit down. It's going to be much better for you to sit down. Yeah, you can do roll both actually if you want. Okay. Yeah, try to roll both. Yeah, just roll it. I like to do roll one. I usually place my one leg on the top of another one, and that's create more pressure. And what I'm doing, I just roll it. Just like that. Roll. No worries. And this is like, take time to practice this. Right. Next one, after you foam rolling like that, you can use the lacrosse ball. Okay. And that's more kind of pressure. You just put, let's put on this one. Let's put on that one. There we go. And what you do, you can play with your hands. Here we go. Is that much better? Yeah. Yeah, the foam roller is like take a little bit of practice, but why I'm doing foam roller, because we don't want to go like too tough on here. All right. So here we go. Just like that.
Feels a lot. Feels so
yeah.
Good on my
When you find a spot, like a sensitive spot, you start moving this foot And what if you can, like she can, we give you her band and help her out. Go ahead, grab it, and you can do this way. Yeah. So ball under the calf, and it's right in here. So you just move. Yeah, like this. Dorsiflex, dorsiflex. There we go. And now after you're done, don't rush yourself. And roll it in and out just like that. Yeah. And that's a good stuff, yeah, when you find those spots. And it's good for the runner, guys. This is great stuff for you. And I will show you really the great one. So you release it. After we massage the calf, we can actually step on the ball. You can just step with your foot and roll that foot. After you're done rolling sitting, you can stand up and put more pressure on this foot if you would like, if you feel okay. You can sit down, you can stay, and you just roll it.
That actually feels really good.
Yeah, really good. That's good.
I can feel a lot of cracking.
Now, after you're rolling, you can do self-massage. You can self-massage, but if you don't do self-massage, you can go call us guys, and we can help you out to work on the muscles surrounding and mobilize your ankle. But if you don't, you use this lacrosse ball and resistance bands. Next one, I will highly recommend start doing mobility and correction exercise. So you go ahead and lay down, sit down. And what we're doing here, we attach this band to the Swedish wall and place on your ankle, on the ankle.
You want me to stand?
Yeah, no, you just let it sit down. And like this, sit down. So you see how I attach this, just like that, and go around your ankle and the top, and cross right here. Now you sit down a little bit further, pull yourself out, and what are you doing? Yes, you just push your knee stay on the ground, and you just move your foot. That's just like that, slowly. Hold it right there, push. And relax. If it's hard for you to do that, you apply another band, which is going to help you. You can use this one.
This actually feels good.
Yeah, just like that. Push, help, always help. This is great for the runner. So you see she pushing, she creates that force, and that's pulling this way. Go ahead and release it, and pull again. Release it, and pull again. Yes. There we go. Now, if you remember, so our foot is going this way, right, David? So we need to activate these muscles on the side to restore that ankle and knee. Go ahead and we're going to release that. What we're going to do, we're going to stand up, and I will show you what we're going to do. So if this is, help me out, David, if this is ankle collapse inside, what we're doing here? So she's collapsing in, right in here.
Yeah, so she needs to, this needs to get stronger.
There we go. So we're gonna face this direction, Natalie, and we're gonna put this bands around, inside the foot, hold on, inside the foot.
She
There we
can't
go.
do
Now
versions.
step more outside, step more. There we go. And now what you wanna do, you wanna collapse this ankle in, just like hold on, just in, like inside, there we go, and like this, and outside, yes, just like this. Don't shift, only work with your ankle. You see she helped with the hip, it's not working, you see?
Right.
Yeah, just ankle, there we go. Try to work through the ankle, let that brain work through the ankle, yes. See, there we go. Yes, so I can pull more and get some more. Here we go, don't raise the hip. Here we go, look at this. You see how this works now?
Yeah.
Yes, so we have this.
It's hard for her.
Exactly.
It is, but I'm gonna work on it.
Yeah. We can also add to the ankle, just create this more power. And you can step outside more, and you can start squatting. Yes, and it's gonna pull. Yeah, squatting more. And look, his knee collapsing in, I'm gonna attach another band.
Right, yeah.
And you just Go ahead, do the same.
Straightens.
Yeah, look at that. And you have to go squatting a little bit more. Oh, we have a hip problem here. Natalie.
Cause she
Unbelievable. Yeah, you have hip problem, big time. Can you go squat lower? A little lower? Oh, okay. Yeah, you see this knee's problems.
Yeah.
Yeah, you can't ski with this knee.
Yeah, I won't be skiing ever again.
No,
so I
but
don't have to worry about that.
you have to do it. I mean, you have to restore it.
Oh,
So yeah,
man.
another one, we're going to do same thing. We're gonna just come up here, both knees, both ankles, sorry, knee spread. And what I want you to do, not that far. So what I want you to do, the same thing. Yeah, like roll it in and out. Good. And out and hold it up there and breathe. Yeah, that's kind of good stuff. I usually start on the ground, but she's already stand up, but that's okay. It's gonna be a little bit more progression. And what I want you to do now, you just roll one foot in, out. Yeah, just like that.
Like that?
Don't use your hip, just you see my hip is in there. Yeah, you see you struggling? Don't raise your ankle also. On the ground, in and out. Yes. That's what we're doing right now. Now try the other one. And look how you're struggling up here. Don't raise it up. You see what's happening? Watch. Good. You see she's collapsing in. Yes, so you need just like that. And it's take time. It's no need to be perfect at this right away. That's why you're training. Yeah, you see how the heel is collapsing in? Yes, right there. So we have some problems up here.
compensating.
Compensating too much.
Yeah.
Yeah, I see.
All right. So that's kind of homework for you. And we can show a bunch of exercise more. Just follow up on the channel and
Will do.